Hi, I'm Jerry Hesch at Hesch Institute in Aurora, Colorado. And today is Happy Green Plaid Day. It's a rumor that plaid is going to come back in style, which I guess that makes me a wise
trendsetter.
A trendsetter, perhaps. So many people that I see are very compressed in their shoulders, okay? Bending over a computer, typing, picking up boxes, whatever you do, making tortillas. I'm from New Mexico, we make tortillas. We get really tight there. And so that tightness over lengthens the scapular stabilizers, the muscles in your upper back. They become inhibited. You can try and strengthen them, but a better way is to actually restore opening in the joint, restore that normal posture. And it's very easy to do. It's very long lasting because this is an interaction with your nervous system. It's not me just making the joint wider. Okay, it's not a joint adjustment. The pectoral muscles will always be tight and you can massage them and keep going back, and keep going back. Or you can open up the joint and the nerves inside the joint, in the ligaments and the joint capsule, muscle tendon that surrounds it, fascia, yada yada. They all have these nerves called mechanoreceptors, and they interact with your nervous system. And when you have this stuck AC joint pattern, they inhibit the stabilizers that would pull it back, and they over tighten the pectoral muscles. So we're dealing with the nervous system here. A very fascinating joint. In a simplistic demonstration, the end of the clavicle is curved this way, and the inside of the scapula is curved this way also. And it's very easy for that scapula to ride forward on the clavicle, and then it becomes compressed. And it takes an intelligent passive force to open that up, and I'm going to teach you what that is. And I could do a dramatic demonstration and show you inhibited muscles in somebody, and then we open up this joint, and then you would immediately see that they are stronger. But I don't have a patient with me right now who presents this way, so we're going to skip that. I may already have other video up, and I'm trying to speak fast and get to the heart of the matter very quickly. I want a brief video. People don't like long videos. So watch what I'm going to do with this. I'm going to take a folded up rag so that it's comfortable, and I'm going to put it in front of my shoulder. Okay, so the purpose is to pad this door frame. Okay, I'm actually leaning into a door. Okay, now I'm going to straddle, so I'm going to put my left foot forward and my right leg back. Okay, if I lean forward, nothing happens. I just feel pressure against my shoulder. Now, when I lean to the left 20 degrees, look at the motion that I'm going to gain. Ready? 1, 2, 3. Do you see all that gain? That takes that shoulder blade backwards, and it gaps that joint and it tractions that joint. And so if someone is really tight and they do this for 2 minutes, the benefit can be very long lasting. I tell my patients who are vulnerable to having this come back to do it twice a week for 2 minutes. Okay, so once again, the starting position is fold up a wash rag for comfort, and bend forward a little bit and lean into the wall. And then you bring your left leg forward if you're treating the right side, and you take the right leg back, okay? If you lean forward, not much is gonna happen, but when you go to the left 20 degrees, if you would come film me from the back, please. Okay? On the count of 3, I'm gonna lean to the left. 1, 2, 3, and look how that opens up. That's the correct angle to open that, okay? So that's a wonderful self-treatment. Read the disclaimer, get the advice of your healthcare practitioner. I can't treat over the internet. If you're going to do it, you have to ask your healthcare person that's how it works. Read the disclaimer, and I hope they give you clearance to do this. I hope it's helpful to you. Thank you.